going today?
Okay, how are you?
Not too bad.
What's going on with Becky? She's acting a little different. Have you noticed that?
I have, but I think something's going on at home. I know she said she was having some issues with her kids, and I don't know, maybe something's going on.
Maybe. She seems really different.
Has she been mean or anything lately, or? Maybe, you know what, maybe I'll pull her aside a little bit later and just talk to her, try and figure out what's going on.
That sounds good.
How are you feeling, Grandma?
Well, I've been doing okay, but there's just some times where like I can't get any relief from this pain in my hip.
Haven't you been taking your pain meds?
Well, I don't know. There's this one nurse that works here in the day shift, and when she works, it just seems like she gives me a couple pills and I take them, and I'm still hurting afterwards. I don't know. Something seems a little weird.
I might have to ask the charge nurse about that. Knock, knock. Hi, Bertha. How are you doing today?
I'm having a lot of pain today.
A lot of pain today.
I really need my pain pill.
Okay. Well, I tell you what, I'm going to give you your pain pill and your other medication with that, okay?
I hope so.
Yep, I really will. So we have your iron pills today, your Norco, your Ativan, your multivitamin, and your Colace, okay?
The Norco's the good one, right?
Yep, it's your brown pill.
Oh, my hip hurts so much.
This is your hip? Okay. Well, I'm going to give you your medication so you can take.
I thought that my Norco was green.
No, that's okay. You know, it's a different manufacturer today. Mm-hmm. And I also gave you your Ativan.
What's that?
Your Ativan? Oh, when you get all anxiety, you get all worked up.
I only get worked up when I can't stand the pain anymore.
Well, the pain pill in the Ativan to help you, okay? Are you all good?
It tastes terrible.
Oh, that's okay. Do you need anything else?
Just need this pain to go away.
It'll go away in a little bit, okay? All right, and I'll be back to check on you, okay? Hey, Bertha. I'm just coming to check on your pain.
It doesn't feel any better than it did earlier.
No? Well, how do you rate it today?
A 10?
Well, you know, sometimes you get worked up and that pain still be there.
Well, I worked up because I haven't had any relief.
Well, Bertha, you're still worked up.
No,
Sweetie,
don't touch
calm
me.
down.
I hurt.
It's okay.
It's not
Do you
okay.
feel like
I'm
you wanna
not
go to
getting
sleep?
any relief. I'm not
Bertha,
going to sleep.
Bertha, calm down. Just breathe through it. She's like this sometimes, sweetie.
No, she's not.
It hurts. Don't touch my
Let me see, Bertha. You know what? I'll give you a few more minutes to make sure that pain medication kicks in, okay?
Chico, my hip, it just hurts so bad. Why isn't it going away?
Oh my goodness, Grandma. Maybe you should put your call light on and we'll talk with the nurse about it.
I just hope that other nurse doesn't come back and she doesn't care.
Hi, what's going on?
Oh, my hip hurts so bad. That nurse came in here earlier and she said she gave me something for pain, but it hasn't done anything, and this only happens when she takes care of me.
How long ago did she give you your
I
medicine?
don't know. When did she come?
It was about an hour ago.
An hour too long.
Where's your pain at?
She's having no
It's
relief.
in my hip. It feels like someone has hit me in the hip with a sledgehammer. It hurts so bad.
Oh, I'm not trying to get anyone in trouble, but I did see that nurse Becky put one of her pills in her mouth.
brown pill that she gave me. That Norco is always green. She said it was brown.
Well, we think Becky is lying, and I'm not trying to get anybody in trouble, but we have an issue here.
Okay, let me talk to the charge nurse and see if we can figure out what's going on with that. In the meantime, do you want to be repositioned or have some ice for your hip to help with the pain?
That would be so wonderful.
Okay, I will get you some ice and I'll talk with the charge nurse and we'll be back in to check on you, okay?
You're such a dear.
Take care, we'll be back, okay? Hey, do you have a second?
Yeah, what's up?
I was just in Bertha McDonald's room,
Okay.
and they're concerned that the nurse is taking her Norco. She's had no pain relief, and there's a different color. They're concerned about that, and they thought they saw her take it when she was in the room.
Okay, why don't I go on in and have a word with her, and if this is something serious, then we're going to have to do an investigation.
Okay, that sounds good. Thank you.
Come in. Good afternoon. How's everybody doing?
Good.
Well, I'm a little better. That really sweet nurse Lindsay came in and gave me an ice pack for my hip, but it still hurts really bad.
And I understand that you've had some concerns with your other nurse, Becky.
Yes.
What are those exactly?
Well, see, I have had this hip pain for years and years, and it's just gotten out of control, and I broke my hip before I came in here. And she comes in here and she tells me that I'm getting something for my pain, and it was a different color. Usually the pain pill is green, and it was brown. And what did she say? Something about some manufacturer?
She said it was the manufacturer switching out, but I seen her. I'm not trying to get anybody in trouble, but I seen her chewing on something, and I believe it was one of my mother's pills.
Okay. That is true that some manufacturers make the same medication, but they do come in different colors and even different shapes. I am going to look
had
in...
no relief whatsoever, and
Yeah,
I
it's
was in
something
so
funny
much
that-
pain.
And looking back on your chart of your pain assessments, I can see a trend. So I will look into this and hopefully get back to you with an answer that is acceptable. And how's your pain level right now?
Well, it's about a 9 out of a 10, and it was about a 10 out of a 10 before she put the ice on, so it's helped a little bit, but this is still just agonizing.
Okay.
I just can't take it.
And
I
when it
understand.
gets like this, when that nurse Becky is on call, I just know it's her.
Yeah, I understand. And believe me, I'm going to do what I can to look into this. And right now, for your pain, I do see that you have some Tylenol or something. Would you like something to hopefully hold you over?
Something.
Okay. I'll send in a different nurse to work with you, but in the meantime, I will go talk with your other nurse right now.
Thank you
you.
so much.
All right, take care. Thank you very much. Becky? Becky? Becky, I need you to wake up. Becky? Hi, I need you to wake up. Can you sit up for me?
Sure.
You okay? A little tired this afternoon? No?
No, I'm fine.
Okay. Well, I'm sitting down. I need to talk to you. Myself and some other staff members have noticed something's a little off, maybe a little change in your demeanor. Your work performance has been affected a little bit lately. Is there anything going on that you'd like to talk about? Or?
No, nothing at all.
Okay, nothing at home.
No.
Everything's fine there.
Yes.
Okay, we have noticed a trend in relation to pain medications and pain relief in patients. And also a complaint has come up.
It is not true.
What's not
Is it
true?
the other nurse who's telling you these things?
I've had complaints
You know she
from
don't like me.
several other people. I understand how you must feel. But like I said, we have noticed a trend, and we want to get you some help if there's something going on.
There is nothing wrong. Nothing at all. Not a thing.
Even now, I can see that your actions are not what they typically are.
What do you mean?
So I think from here, I'm definitely going to have to ask that you go in for some testing. We can test your blood results for any medication.
No, I
in
will
your
not
system.
do that. I refuse. This is the way to get me out of here.
What do you mean get you out of here?
You don't want me working here.
We definitely do enjoy your work ethic and such, but we
I don't
are
have to take
concerned.
this. I'm leaving.
Thank you for watching our little skit today. Even though the skit was meant to be hilarious, this is a pressing topic in our world today. Nurses who steal medication is a serious issue in our healthcare system. Many patients are suffering at the hand of nurses who are addicted to pain medication, anxiety, and depression medication. Patients look at the nurses with the utmost respect and will take and believe whatever the nurse tells them to. So, some patients won't even know if what they're actually receiving until increased pain or withdrawal from medication happen. Unfortunately, this problem is all across the board, from the ER to nursing homes.
Incidence of addiction. The National Institute on Drug Abuse estimates that 10% of U.S. adults abuse drugs during their lifetime. Accurate statistics are difficult to obtain because drug abuse and addiction are often cloaked in silence. Drug addiction is a major health risk among nurses, and according to the American Nurses Association, 10% of nurses are dependent on drugs. With nearly 3 million RNs employed in the United States, that means almost 300,000 RNs may be substance abusers. Some nursing specialties such as anesthesia, critical care, oncology, and psychiatry are believed to have higher levels of substance abuse because of intense emotional and physical demands and the availability of controlled substances in these areas.
Drug abuse in nursing is a serious problem. There needs to be some kind of repercussions for the nurse who either comes to work impaired or abuses drugs by stealing them or by taking them from the patients in the workplace. Staff and other nurses need to be aware of what to look for in an impaired nurse, and these signs may be a disheveled look, lack of care for self, or acting differently, as you could see in our skit. And some states do things differently on how they deal with the situation when they have an employee, a nurse who is impaired. Generally, they may have like a license revocation or suspension that is temporary, maybe for a couple of years, or they may be monitored very, very closely by staff, or I know some states do peer monitoring. While this is good and it gives the nurse a chance to kind of redeem herself, the chance of relapse is kind of high. So I think we need to look at permanent revocation as well, depending on the situation and depending on if the nurse has had a history of problems with drug and alcohol abuse in the past.
Nursing tends to be a really high-stress job, so if you start to feel stressed out, there's certain things you can look into to try to alleviate that stress, such as transferring to a different unit that might not be such high-stress environment, changing shifts if third shift is too stressful going to first or vice versa, cut back on your hours if possible, maybe working 2 days a week instead of 3. Manage your stress at home, whatever is bothering you at home. Try to leave it at home or deal with it in a way that is good for you, such as exercise. Reach out for help. Don't be afraid to ask for help from your fellow employees or your family. Get medical help, and see a doctor if there seems to be an underlying issue such as depression.
It is important to recognize those around you who are displaying signs and symptoms of substance abuse. It's important to intervene early as well. If you are the one abusing substances, you need to remember that not only are you putting yourself and your patients at risk, you're also jeopardizing your job and your licensure. Act now and get help.